In the annals of true crime, there are figures whose stories are so disturbing, they capture the public's imagination and haunt the collective consciousness for years to come. One such figure is Kristen Gilbert, a former nurse whose actions at the Veterans Affairs Medical Center in Northampton, Massachusetts, shocked the nation and forever changed the way we view healthcare providers. Born on November 13, 1967, Kristen Heather Gilbert grew up in a seemingly ordinary household in Fall River, Massachusetts. Her early life offered no hints of the horrors that would later be associated with her name. Gilbert was an average student and displayed no overt signs of psychopathy or violent tendencies during her formative years. Yet beneath this veneer of normalcy, a disturbing darkness was lurking. Gilbert's descent into a life of crime began when she decided to pursue a career in nursing. She graduated from Greenfield Community College's nursing program in 1988 and quickly secured a job at the Veterans Affairs Medical Center, VAMC, in Northampton. Little did anyone know that the hospital was about to become the stage for a horrifying saga. In her role as a nurse at the VAMC, Kristen Gilbert appeared to be a dedicated healthcare professional. She was responsible for the care of critically ill patients, many of whom were elderly veterans. Her colleagues initially saw her as competent and compassionate, but as time went on, they would come to realize that beneath her facade of professionalism lay a chilling secret. It wasn't long before an alarmingly high number of patients at the VAMC began to die under suspicious circumstances. Patients who had been recovering suddenly took a turn for the worse, and their deaths were often attributed to heart arrhythmias. This pattern raised red flags among the medical staff, who began to suspect that something was amiss. The hospital administration launched an internal investigation into the unusually high mortality rates on Gilbert's watch. What they discovered was nothing short of horrifying. Kristen Gilbert was systematically murdering her patients with lethal injections of epinephrine, a drug that can induce heart attacks and cardiac arrest. The motive behind Gilbert's heinous acts was rooted in a twisted desire for attention and the thrill of playing God. She reveled in the chaos and drama that surrounded her patients' deaths, often feigning grief and shock. Her colleagues, who were initially baffled by the sudden uptick in patient deaths, began to piece together the puzzle. It was a combination of factors that finally led to Kristen Gilbert's downfall. Suspicion grew as more and more patients under her care succumbed to unexplained deaths. Colleagues who had worked closely with her started to come forward with their concerns, and the hospital's internal investigation intensified. The breakthrough in the case came when a nurse named Nancy Zekin noticed vials of epinephrine missing from a medication storage area. Zekin alerted hospital authorities, who subsequently conducted a search of Gilbert's home. What they found was a chilling cache of stolen hospital supplies, including epinephrine, syringes, and various medications. Kristen Gilbert was arrested on February 15, 1996, and the magnitude of her crimes began to emerge. During her trial, Gilbert was charged with 4 counts of first-degree murder and 2 counts of attempted murder. She stood accused of killing 4 patients and attempting to murder 2 others by administering lethal doses of epinephrine. The trial captivated the nation as the public grappled with the idea that a healthcare provider, someone sworn to do no harm, could commit such heinous acts. As the trial unfolded, it became clear that Kristen Gilbert's motives were far from ordinary. She seemed to relish the attention and chaos that surrounded her actions. Prosecutors argued that Gilbert suffered from Munchausen syndrome by proxy, a rare psychiatric disorder in which an individual seeks attention and sympathy by causing harm to others, often in a caregiving role. Throughout the trial, Gilbert displayed a cold and detached demeanor. She showed little remorse for her actions, even as the devastating impact on the victims' families was laid bare. The jury ultimately found her guilty on all charges, and she was sentenced to life in prison without the possibility of parole in March 1998. The Kristen Gilbert case had far-reaching consequences beyond her own conviction. It raised critical questions about hospital security, patient safety, and the oversight of healthcare professionals. Hospitals across the country implemented stricter controls over medications and access to them, as well as more stringent background checks for healthcare workers. The case also shed light on the importance of vigilant colleagues who are willing to speak up when they suspect wrongdoing.